But let's take a look at some compounding considerations. When you have a compounding prescription that comes in, there's questions to ask sometimes before, it might be during, or even after the compounding process. Physicians have no way of knowing, really, all of the products that are available out there. And that's why it's so important for patients to understand that when they're dealing with medications, they really need to talk to the pharmacist. So some of the questions that may be asked is there a commercial product that's already available? If there is, why are we going to go through that compounding process? Maybe the physician doesn't know that this product is available, or maybe it's a like product that is equivalent to that. All right, it's going to serve the same purpose, it just is named differently. Are there any commercial ingredients different from the prescription so that the product cannot be used? Okay. If the answer is no to that, the pharmacist should determine what the purpose of the prescription is for. Can the purpose be achieved without having to compound a product? And that might very well be the case, that you don't even have to go through the process of compounding something because, there is something that could be used. It might not be the same medication, but it is something that could be used. And of course, that pharmacist would need to talk to the physician about that. Is the pharmacist qualified to prepare the prescription? Now, we're not asking about the competency here, whether or not this is a good pharmacist or is he in the back getting drunk. That's not it at all. But is the pharmacist qualified to prepare the prescription? Are we in a pharmacy that would allow us to create this compounding ingredient? Is the proper equipment and supplies available? Because if they're not, you're not going to end up with a good product. You're not going to meet those guidelines and those standards that are required to maintain compliant with the USP. And can the drug and ingredient identity, quality, and purity be assured? So if we go through and we actually make all this, can we ensure this? Is there any literature about the formulation to help determine an appropriate beyond use date? Something to keep in mind, because we can't use the expiration dates that are listed on the products that we're going to be using. We can refer back to the chapter, but again, if we don't have enough information regarding that, it's going to be difficult for us to ensure the beyond use date on that. And what basic quality control measures will be used to assure that the prescription is compounded correctly? We need to ensure that there are policies and procedures that are set in place following the USP guidelines, making sure that we are compliant. And does the patient have the necessary skills to use and store the prescription?